The dog wouldn't let anyone near him. That was the first thing Lena Burkett noticed when the ambulance bay doors swung open at 11:42 on a Tuesday night. Not the man on the gurney, though he was hard to miss, 6'2" of barely contained tension, jaw clenched so tight she could see the muscle working from 20 feet away. It was the dog. A Belgian Malinois, the color of burnt caramel, positioned between the stretcher and every person in scrubs who tried to approach, head low, hackles raised, completely silent, not growling, not snapping, just there, immovable, like a wall that had decided to become an animal. "Ma'am, you need to control your—" One of the EMTs started, and the man on the gurney said, quietly and without turning his head, "His name is Caspian, and he's doing exactly what he's supposed to do." Lena had been a nurse for 6 years, 4 of them in the behavioral health unit at Riverside Regional. She had seen a lot of things come through those doors. She had learned, in the particular way you learn things in this job, through the body before the brain, to read a room in the first 3 seconds. And what she read in this room in those first 3 seconds was, this man is not a danger. This man is in danger. There is a difference, and it matters, and almost nobody in this hallway understands it yet. She set down her clipboard. "Hey," she said, not to the man and not loudly. She crouched, slowly, until she was at the dog's eye level. Caspian's amber eyes tracked to her immediately. "Good boy," she said. "You're doing your job. I see that." The dog's ears shifted, just slightly. The ridge along his spine didn't fully settle, but something in his posture changed. A fraction of a degree, the difference between a bowstring drawn and a bowstring at rest. The man on the gurney turned his head for the first time and looked at her. His name, she would learn from the intake form, was Stellan Vance, 38 years old. Former Special Operations, Army, not Navy, she noted, because it mattered to get it right. Former Ranger. 2 deployments to Afghanistan, 1 to Iraq. Medically separated 14 months ago after a vehicle accident that left him with a traumatic brain injury, a shattered left knee, and a diagnosis of severe PTSD that the VA had been managing, more or less, for the better part of a year. The paramedics who brought him in said a neighbor had called, said he hadn't come out of his apartment in 4 days, said she'd heard him through the wall talking, not to anyone, just talking, the way people talk when the inside of their head gets too loud. The neighbor had knocked. Stellan had not answered. She'd called 911 anyway, because she was a 72-year-old woman named Dottie who had a son in the National Guard and believed in paying attention. Lena read all of this in the intake notes while Stellan sat upright on the gurney. He'd refused to lie down, with Caspian pressed against his left leg and his right hand resting on the dog's back. Not gripping, just resting. The way you might rest your hand on something to remind yourself it's real. "Mr. Vance," she said, pulling a chair close to the gurney. "Not behind the desk, not at the nursing station, right there, at his level. I'm Lena. I'm going to be your nurse tonight. Is it all right if I ask you a few questions?" He looked at her with the particular look she'd seen before, the one that wasn't hostility, exactly, but was its close cousin. The look that said, "I have been asked a lot of questions by a lot of people who did not listen to the answers. Depends on the questions," he said. "Fair enough," she said. She asked him about pain first, the knee. He had a prescription for it. He told her the name, the dose, and he'd run out 2 days ago. She wrote it down. She asked him when he'd last eaten. He thought about it. "Yesterday morning," he said, with the faint surprise of someone who hadn't realized until just now. She wrote that down too. She did not ask him why he'd stopped leaving his apartment. She did not ask him what he'd been saying to himself through the walls. Those questions had their place, but that place was not the first 5 minutes. "Caspian," she said when she'd finished the intake. "That's an unusual name for a working dog." Something shifted in Stellan's face, not quite a smile, but the territory adjacent to one. "He came with it," he said. "From the program. I thought about changing it." A pause. "Didn't seem right. How long have you had him?" 8 months. He's well-trained. He's better than well-trained." Stellan's hand moved slightly on the dog's back. "He's been doing his job for 8 months straight. Never misses a beat." Another pause, and Lena had learned by now to let the pauses breathe. "I'm the one who stopped functioning, not him." She looked at him steadily. "You're functioning right now," she said. "You answered the door. You came in. You told me what you need." She capped her pen. "That's functioning." He didn't answer, but he didn't look away either. The trouble started 20 minutes later, when Dr. Fenwick arrived. Lena had worked with Fenwick for 2 years. He was not a bad doctor, technically speaking. He was organized, he was efficient, he ran his unit the way a person might run a very orderly supply chain, inputs, outputs, throughput. What he was not, and had never been, was a person who sat with discomfort long enough to understand it. He walked into the room, saw the dog, and said, "That animal needs to go to the waiting area." Stellan's hand stopped moving. Caspian's head came up. "He's a certified psychiatric service dog," Lena said, before Stellan could respond. "He's covered under the ADA. He's allowed to remain with his handler in any area of the hospital." Fenwick looked at her the way he sometimes looked at the nursing staff when they said things he considered presumptuous. "This is a behavioral health unit," he said. "We have protocols." "We do," she agreed. "And the protocol, per federal law, is that a service animal cannot be separated from its handler without a specific documented safety concern." "Do you have one?" Fenwick's jaw tightened. He was not used to being quoted law in his own unit. "The animal is a distraction." "To whom?" A pause. "To the other patients. There are no other patients in this room," Lena said. "There's just Mr. Vance, and Caspian is the reason, Mr. Vance is calm enough to be here at all." Fenwick looked at Stellan, who was watching this exchange with the flat, measuring attention of someone who has sat through a lot of briefings and knows exactly how power operates in a room. "Mr. Vance," Fenwick said, "hospital policy requires—" "Your policy," Stellan said quietly, "doesn't override federal law." Lena watched Fenwick recalibrate. He didn't leave, not yet, but he didn't push further either. He told her he'd be reviewing the admission paperwork and walked out. The door didn't quite slam, but it came close. Stellan watched the door for a moment. Then he said, without looking at her, "You know he's going to make that difficult." "Probably," she said. "You didn't have to do that." "Yes, I did," she said simply. "It's literally my job to advocate for my patients. That includes making sure the people who are supposed to be helping you don't accidentally make things worse." He looked at her then, directly, the way he hadn't quite looked at her before, like he was reassessing something. She didn't push it. She got him a sandwich from the nutrition cart and a blanket for Caspian. The dog accepted it with dignified gravity, turning twice before settling, and she went back to her station to start making phone calls, because there was one thing she'd noticed in the intake notes that nobody else seemed to have flagged. Stellan Vance's VA case manager was listed as a Dr. Pullman who had reportedly been managing his care for 11 months. There were 3 prescription renewals on file. There was no therapy documentation. There were no crisis plan notes. There was no record of any follow-up contact after his last appointment, which had been 6 weeks ago. 6 weeks of silence, and nobody had noticed. Lena sat with that for a moment. Then she picked up the phone. She couldn't reach Pullman that night. It was past 1 in the morning by then, but she documented everything. The lack of follow-up, the lapsed prescription, the 4 days of isolation before anyone noticed. She wrote it all down, precisely and without editorializing, in the kind of clinical language that becomes very loud when read by the right people. Around 2:30, Fenwick came back. He had, apparently, found a hospital policy, a real one, dug out of some administrative archive, that stated service animals could be relocated to a designated area if deemed necessary for patient care. He presented it with the quiet satisfaction of a man who has gone home to find the tool he needed. That policy, Lena said after she'd read it, was last updated in 2011. The ADA guidance on psychiatric service animals was revised in 2011 and again in 2016. This policy is not compliant with current federal law. That's a legal interpretation, Fenwick said. It's the law, she said. If you want to separate Mr. Vance from his service animal, you'd need to document a specific individualized safety threat, not a general policy preference. She looked at him calmly. I'd also want to note, for the record, that Mr. Vance's psychiatric stability tonight is directly related to Caspian's presence. Separating them without clinical justification could constitute a violation of his rights and a deterioration of his care. Fenwick stared at her. Where did you learn all this? She considered the question. My father, she said, was a Marine. He came home from Fallujah and spent 3 years fighting the VA for the right to keep his own dog in transitional housing. She paused. I paid attention. She had not planned to say that. She didn't usually say it. But something about the hour, or the look on Stellan's face when she'd stood up for him the first time, or just the accumulated weight of 2 years of watching this particular kind of failure. Something had loosened the usual gate. Fenwick left again. This time he didn't come back. At 3 in the morning, when the unit was quiet, Lena brought 2 cups of bad hospital coffee. One for her, one that she set on the tray table near Stellan without asking if he wanted it, and sat down in the chair she'd pulled up hours ago. "You should try to sleep," she said. "Don't really do that anymore," he said. "The sleeping or the trying?" A long pause. "Both, some nights." She nodded. She didn't say she was sorry, because she'd learned, through her father and through 6 years of this job, that sorry was often the least useful thing you could offer someone who had stopped expecting things to work out. "What helps?" she asked instead. "When it gets bad." He thought about it with the same care he brought to everything. Lena had noticed this, the deliberateness of him, the way he processed before he spoke, as if words were resources to be conserved. "Movement," he said finally. "And him." A glance down at Caspian, who was asleep with his head on Stellan's boot. Knowing something is still working right, even if everything else isn't. "He's working right," she said. "Yeah." Something in his voice, not quite grief, but adjacent to it. He deserves better than this, is the thing. He deserves a handler who's got it together. She looked at him. "He looks pretty content to me." Stellan looked down at the dog. Caspian's ribs rose and fell, with the slow certainty of deep sleep, his paws twitching slightly, chasing something, maybe, in whatever dogs dream about. The tension that had been in Stellan's shoulders since the ambulance bay had not entirely left, but it had settled. It was the kind of settling that happens when a person is finally genuinely still. "Caspian," she said quietly. The dog's ear flicked. He didn't wake. "That's a sea," she said. "The Caspian Sea. Landlocked, surrounded on all sides." She glanced at Stellan, but still navigates by its own rules. Doesn't behave like it's supposed to. Stellan was quiet for a long moment. "My CO used to say that," he said slowly. "About the men who didn't fit the standard profile. Said the ones who seemed contained were usually the ones with the most going on underneath. Smart. He was." A pause. "He died in Kandahar in 2019. Lena didn't fill that silence. She let it exist, which is its own kind of care. "I haven't talked about him," Stellan said, and his voice was different now, not guarded in the same way, or guarded toward a different thing. "Not to anyone who wasn't there. The therapist at the VA, she's fine, she tries, but she keeps asking me how it made me feel." A sound that was not quite a laugh. "I don't know how it made me feel. I know what it meant." "There's a difference," Lena said. "You know what OPORD stands for?" "Operations Order," she said. 5-paragraph field order. Situation, mission, execution, sustainment, command, and signal. He looked at her. "My dad drilled it into me when I was 12, she said, because he thought it was the most useful structure ever invented for doing anything. He used it for grocery shopping." A pause. "I used to help him write his." The look on Stellan's face was one she recognized, though she rarely saw it directed at her. It was the look of someone realizing, mid-sentence, that they are not alone in the room in the way they thought they were. "Your father," he said. "He came home." "He did," she said. "It took a while." "But he did." She did not make that into a promise or a reassurance or any kind of lesson. She just said it and let it be what it was. At 4:15, while Stellan slept, he'd drifted off somewhere in the previous hour in the middle of a sentence, in the way exhausted people sometimes do when they finally feel safe enough. Lena went back to her documentation. She had been building a case methodically without announcing that's what she was doing. Every lapsed prescription, every missed follow-up, every policy Fenwick had cited that didn't hold up to the actual regulatory standard. She had written it down. She had noted the name of the policy, its last update date, the relevant federal statute that superseded it. She had documented Caspian's service animal certification, which she'd asked Stellan for early in the night, and he'd produced from a battered wallet with the particular efficiency of someone who has had to prove his dog's legitimacy many times before. She had also sent an email, at midnight, before the second confrontation with Fenwick, to the hospital's patient rights coordinator. Not an accusatory email, a documentation email. "I want to make sure I'm following the correct protocol," she had written, and then listed precisely what had happened. The patient rights coordinator, a woman named Miss Oduya, who Lena had spoken to exactly twice before, replied at 5:47 in the morning. She thanked Lena for the detailed documentation. She said she would be reviewing the admission. She CC'd the director of nursing. Lena read the email at her station, with the first gray light of an October morning coming through the window at the end of the hall, and felt something settle in her chest. Not victory, it wasn't that. More like, the right thing is now moving in the right direction, which is different from winning, but is its own kind of solid. Around 6, Stellan woke. He blinked at the ceiling for a moment with the specific disorientation of someone who has woken in an unfamiliar place and is, for the first second, not entirely sure which unfamiliar place it is. Then Caspian stood and put his head in Stellan's hand, and Stellan's eyes cleared. "Morning," Lena said from her station. He looked at her. "You're still here. My shift ends at 7. He looked at the window. "You've been here all night, so have you," she said. He sat up slowly, testing his knee with the careful movement of someone who has learned to negotiate with his own body. "The doctor," he said. "Fenwick. Is he? He's not coming back with that," she said. "I made sure of it." Stellan looked at her for a moment. "Why?" he said, and it was not an ungrateful question. It was a real one. A person who has been failed enough times starts to need to understand the mechanism of kindness before they can receive it. She thought about how to answer that. "Because I kept thinking," she said, "about what it would have looked like if you hadn't known your rights. If you hadn't pushed back. If Caspian had been taken to a waiting room and you'd been left alone in here at 2 in the morning with a lapsed prescription and a TBI and nobody who spoke your language." She paused. "And because that almost happened, and I needed it to not happen." He was quiet for a long time. "My CO," he said finally, "used to say that the most dangerous moment in any operation is the one where everything seems under control." He looked down at Caspian. "Because that's when people stop paying attention." "Somebody paid attention," she said. "Your neighbor Dottie paid attention. And you let the paramedics in. That's not nothing." Something crossed his face, complicated, unresolved, the kind of thing that takes years to work through and doesn't simplify itself just because it's almost 7 in the morning. But it was there. A crack in the wall, not wide enough to walk through yet, but wide enough for light. "The VA case manager," she said carefully. "Pullman, I left a note in your file about the lapsed prescription and the gaps in follow-up. That's going to need to get addressed." His jaw tightened slightly. "The VA's been—" "I know," she said. "I know. But there are people inside the system who care, too. Not everyone, but some. And the documentation I put in your file tonight, it's going to make certain things harder to ignore." She paused. "I'm not telling you to trust the system. I'm telling you that what happened here tonight is now on record, and it makes it harder for them to look away." He absorbed that. "You documented the thing with Fenwick, and the policy he cited, and its last update date, and the federal statute that supersedes it." She allowed herself the smallest amount of satisfaction, thoroughly. For the first time since the ambulance bay, Stellan Vance almost smiled. It didn't fully form, it stopped somewhere short of his eyes. But it was there, in the way a thing can be present without being complete. "My CO," he said, for the 3rd time that night, and his voice was different when he said it now, softer, not painful in the same way, "would have liked you." "I would have liked him," she said. Her replacement, Gina, arrived at 10 to 7, cheerful and carrying a travel mug. Lena gave her the handoff, thorough, specific, pointing at every note she'd made, and caught Gina's eye when she got to the part about Caspian. "He stays," Lena said. "It's documented. If anyone pushes back, Ms. Oduya's been copied on the email." Gina nodded. She had been a nurse for 11 years and understood, without needing it spelled out, what "it's documented" meant in this context. Lena gathered her bag. She stopped in the doorway of Stellan's room on her way out. He was sitting on the edge of the bed, Caspian standing between his knees, and he was doing something she hadn't seen him do all night. He was talking to the dog. Not words she could hear. Just a low, steady murmur. The kind of thing you say to something when you don't need it to understand you, just need to say it. She didn't interrupt. She just stood there for a moment, in the threshold, and thought about her father, the way he'd come back from Fallujah like a coastline after a storm, familiar in shape but different in texture, and how long it had taken and how much it had taken, and how most of the people who helped him were not the ones whose names ended up in any official report. She thought about Dottie, who had knocked on a wall. She thought about the email sitting in Ms. Oduya's inbox and the director of nursing CC'd at the end, and the 12 pages of documentation she'd filed between midnight and 5 in the morning, and how none of it was heroic exactly, but all of it was necessary. The way most of the things that actually matter are quiet and specific and done when nobody is watching. Stellan looked up and saw her in the doorway. She lifted one hand, not a wave, just an acknowledgement. He held her gaze for a moment, and then he nodded, once, deliberate, the kind of nod that means more than its size. She turned and walked down the hall through the double doors into the cold October morning that was just deciding to become day, and she went home. 3 weeks later, she got an email from Miss Oduya. Dr. Pullman's caseload had been audited. 14 veterans had been identified with documentation gaps similar to Stellan's. A new follow-up protocol was being implemented. The hospital's service animal policy had been formally updated to align with current ADA guidelines, which she noted, with the particular dryness of someone who had been in healthcare administration long enough, should have happened in 2016. At the bottom of the email, almost as an afterthought, Mr. Vance has been assigned a new case manager and has enrolled in an outpatient program. His attendance has been consistent. Lena read that last line twice. Consistent. She thought about a man who had not left his apartment in 4 days. She thought about a dog who had positioned himself between his handler and every stranger in the room, who had accepted a blanket from her hands at 2 in the morning with quiet dignity. She thought about a CO who had died in Kandahar in 2019 and who had apparently said exactly the right things to the men under his command, because those men were still quoting him years later in hospital rooms at 4 in the morning. She thought about what it means to hold a line when nobody has asked you to, what it costs not to. She typed a reply to Miss Oduya. Thank you for the update. Please make sure the new protocol includes a check-in timeline, not more than 30 days between contacts. Gaps are where things go wrong. She hit send. Then she got up, put on her jacket, and went to work.